Renu, how are you?
I'm good, Declan. How are you?
I'm good. Nice to be back in the studio.
Nice to be back in the studio. And today we're going to stray a little bit from our usual topic of GU Oncology. Bizarre, but we're going to do that because we want to bring you an amazing story that Declan heard when we were in London for a few days recently. It was pretty cool.
Yeah, we've kind of stuck to the idea of GU Oncology is our thing, and all of urology is interesting, but we focus on GU Oncology. But when we were in London, I came across this story and I thought we have to jump on this and do a podcast.
Absolutely, yeah. I mean, and we did spend a few days in London after EAU this year. It was a productive few days. We got up to a lot, actually.
It was a great few days. We've already posted the Radiation Cystitis podcast, and boy, have we had a good reaction to that. So,
yeah, that was a great topic, and two fantastic speakers, great location. So if you haven't checked it out already, please do. It was really quite fun to do, very informative. I learnt a lot, and I think our audience will too.
Yeah, and thanks to Yasmin and Ramesh and everyone at Guys for allowing us to do that focus on radiation cystitis. So important when we've had incredible feedback. We might even have to do a bit more about that, actually.
Yeah, because I think what we heard from them was really the tip of the iceberg. And I mean, it really is an amazing responsibility that they've taken on to build that service, and they've done an amazing job. And I'm sure their day-to-day work is not glamorous.
And that was one podcast, but we've another one due to come out very soon as well, which features our great adventure watching Declan Cahill and Chris Eden do Da Vinci single port surgery, which was great
really
fun.
Cool. Yeah, so, 2 days of watching surgery with them in the OR. It was really good fun.
So that's coming up soon as well. There's another one from the team at UCL Compass, which is Viru Kazi's young team of very enthusiastic young researchers. We'll post that one in a few weeks' time as well. But it wasn't all podcasts. We had a couple of other things we got up to while we were in London.
We did. Well, the first thing was we visited the Royal Marsden Hospital. Oh, yeah. That was really fun. So we sat in for their MDT meeting and joined the clinic with Nick James, with Hoda. And Anna Wilkins.
Anna Wilkins, yes.
Yes, do you remember Anna Wilkins? We ran into her while we were waiting to start the MDT at the coffee shop just around the corner from the Royal Marsden, and she recognised us and came up to us. It was the most bizarre moment, but she then accompanied us to the MDT and then clinic afterwards. So a huge shout out to the team at the Royal Marsden. We had an amazing time spending the morning with you all.
Yeah, it was really a Rolls Royce of an MDT meeting followed by clinic. It was really awesome. So thanks very much to Nick James for welcoming us in there. And great team. Great. Learned a lot from that morning. That was really good.
And it just so happened, and we didn't plan it, that our 5th birthday of the podcast of GUcast fell right when we were in London. So we had a great time celebrating.
We did. We happened to be there literally 5 years to the day. So we took over the back of a pub and we'll post a little bit about that in the next couple of weeks as well. And lots of friends of the podcast turned up and had a drink.
Such fun.
That was great fun.
Yeah, it was great to be overseas for it. And,
5 years old, Renew.
5 years old. Amazing. So that was really good fun. Yeah. And then you stayed on. For a few days even after that, and you were at Guy's Hospital for their Friday morning talk. I've heard a lot about these Friday morning, talks and meetings.
The Friday morning meeting at Guy's, all of you who've trained there or worked there or passed through there will know that it is just a fantastic academic meeting, which has been running for decades, literally, still run by the great Tim O'Brien, great mentor of mine. And it's had the exact same structure, Renew, for all of that time. And I remember before COVID, I went back for their 1,000th Friday morning meeting, and a big group came back for that. But it hasn't changed. They have a case of the week, they have an X-ray of the week, and then they have an academic discussion. And it all takes exactly 60 minutes, and it's all done and dusted on a Friday morning. So I got to do the presentation on that Friday morning after you went back to Melbourne. But before I did, as usual, there was the X-ray of the week, Raj Nair, beautiful X-ray with some teaching points. And then the case of the week, which is what we're going to feature on this podcast. And the case of the week was delivered by one of the fellows, Andrology Fellow, Dr. Joachim Jimie. Jimie, he goes by. Dr. Jimie. Yep, from St. Lucia, who had just recently started his fellowship, his Andrology Fellowship at Guy's. And his case of the week, we thought it's going to be some andrology thing, some funny, weird penile thing. And it was titled, "Is There a Doctor on Board?" which is the title of our podcast today. And look, it was jaw-dropping. He's a great character. He's a great presenter, but he told an amazing story. And it wasn't just an amazing story of what happened, as he'll tell us about here on the podcast in a few minutes, but there were lessons in there. There were life lessons in there as well, which I really enjoyed. So straight afterwards, we still had all our kit there set up for recording podcasts. So I asked Jimmy, would he come out and record this podcast? So I do hope that you enjoy this.
Yeah, so we're happy to bring it to you. Is there a doctor on board?
Here we go.
Please enjoy.
So, Jimmy, thanks very much for joining us here on GU.
welcome.
As I explained in the introduction with Renew back in the studio, we're a little bit away from our normal topic of GU Oncology, which is our whole identity, because of this extraordinary experience I had this morning here at Guy's, listening to your story. So I think it's something for an audience like ours, which is predominantly, I think, people working in healthcare. It'll resonate. Everyone's been on a flight when we get a call like that.
Absolutely, and I think it's an experience probably many persons want to avoid, but when you do experience it, it's phenomenal.
Fantastic. Well, before we ask you to tell us the story that you told us this morning, tell us a bit about yourself and your background.
Yeah, so my name is Joachim Jimie, and everybody calls me Jimmy, and that's absolutely fine. I am from St. Lucia, and I moved over to the UK to do my specialty training. So I was trained in the Merseydeanery, the Northwest, and then finished my training actually just this year, and now I'm doing my post-CCT Urology Fellow here at Guy's and St. Thomas's.
Wonderful. Well, I wish you all the very best with this, and I suppose we do touch on andrology and GU Oncology a little bit because you're often helping us recover our patients from all sorts of functional point of view. So important training and great centre here at Guy's. But yeah, so back to the story, the case of the week. And we've titled this podcast, Is There a Doctor on Board? Because that's how you framed your talk this morning.
Indeed.
Tell us the story.
Yeah, so, I'm heading back from the UK to St. Lucia to go home on vacation. And as anybody would, you enjoy having a good time in your flight. You focused on what you're doing. But then I noticed that something was a bit off. The flight attendants were a little busier than you would expect them to be, and I thought, what could be happening? But when I noticed that they started putting around oxygen tanks, then I figured, yeah, there was
up and
something.
down the
up and
aisle,
down the
okay.
aisle of the horse, the airplane. Then I realized something must be happening, and as most of us would do, I decided, to just crawl myself back in a bit, put on my headphones and thought, I'll probably escape and not have to be involved in whatever is going on. And lo and behold, that dreaded announcement was made on the flight. Do we have a doctor on board? And initially, I was quite skeptical. I was like, well, this is a flight with over 300 people.
Yeah, sure.
And there must be another
few.
doctor someplace around. And I was very skeptical initially, but 5 minutes later, the announcement came out again.
Okay.
At which point I thought, maybe I should find out what's really happening. Because, just in the background, I had previously assisted on flights before, and there was simple stuff. So someone was hypoglycemic, and someone had an allergic reaction. So I thought, I feel pretty bad if it's something so simple, and then I have not gone forward to offer my assistance. So reluctantly, I went over to find out what was happening. And to my surprise, there was this patient on the floor, on the airplane, obvious respiratory distress, cyanotic, oxygen pulsimetry on, and had a low count. It was down to about 60-something%. You could see that her neck veins were bulging, and then automatically the first thing that came to my mind is this patient is probably having a tension pneumothorax.
So just for the non-medical audience out there, so basically this lady is lying on the floor of the airplane. She looks blue, literally, probably. She's not getting oxygen to the vital parts of the body. Her lungs have shut down, and the pulse machine is saying, this lady's oxygen levels like critically low. She's dying on the plane. And so this looked like an extremely unwell person.
And at this point, the question is, how much can you really do in these circumstances? Because even in a hospital setting, when you have patients who are so unwell, the amount of effort, energy it takes to actually get them better is quite remarkable, quite a lot. And now to have to do these very same, procedures, maneuvers on an airplane with limited resources, it actually is a very stressful situation. So
it's okay. You've arrived. There's no other nurses or doctors or anybody. It's like a very worried-looking cabin crew, I suppose, and loved ones.
Yeah, it is. So when I realized what was really happening, I did ask to, put out another call to see if there was some other colleague who could offer some sort of assistance and to, so that we could run through some sort of process in how to manage this patient, like we would normally do in our daily practice. But unfortunately, I was on my own day as a medical professional alongside a well-capable cabin crew.
Yeah. And then, so you've looked at her and you've said, right, tension pneumothorax. So tell us in layman's terms what that is. It's one of those classic emergency situations that needs immediate action. But just if you could explain it in simple language.
Yeah, sure. So basically, a tension pneumothorax is you literally have air trapped between the lung and the cavity. The chest wall. The chest wall. And then what has happened is it's creating a pressure there, and then it compromises basically your breathing as well as your circulation.
Yeah.
So you're at a very high risk of basically arresting.
Yeah, and meet within minutes. Okay. So that was your assessment. Tell us what happened then, and you're looking for equipment, I suppose. And
yeah. So at which point, I didn't expect them to actually have what I would need in these situations.
Yeah.
But what I did first was a needle decompression. So which is basically to stick a needle in the intercostal space to basically decompress the trapped air in the lung. That worked, but at which point I said to the crew, whatever you have to do, but this plane needs to be diverted and landed immediately.
So you thought, okay, I've temporarily relieved this pressure, but this lady is going to die. But roughly, where were you? Have you any idea where you?
No, so we were probably maybe 4 hours into the flight.
Okay.
So
right.
the sad
over the
thing
Atlantic.
Exactly. So that's the disadvantage of flying to St. Lucia. You literally fly over the Atlantic with nothing below you, so you literally have to divert in case of any emergency.
Okay, so you pop the thing in, and did you get the classic, like, I suppose you can't hear on the airplane, but normally when you do that in the emergency department, I remember from 20 years ago, like you get a little kind of a whistle because the trapped air is coming out, and then the lung is refilling, and hopefully, and you could probably see the oximeter improving, so that you were happy then for a few moments.
Yes, I was. Obviously, you limited because even if I had a stethoscope, it was extremely difficult to really hear any sort of breath
sounds. So no stethoscope, you couldn't listen?
Well, there was a stethoscope, but it's because of the cabin pressure and the noise in the cabin, it's extremely difficult to really hear the breath sounds.
And how did you know which side had she pain?
Because of the side that had the engorged neck. Yeah, so because we know it pushes on the contralateral side.
He's a real doctor, this guy. I'm so impressed.
Yeah.
Okay, so she's getting a bit better, and you've said please land the airplane somewhere, which could still take an hour or two, I suppose, until you get to land.
Yeah. At which point I decided to use this opportunity because her daughter was with her, to get some information, background information. What's been going on with her? Has she been sick? Is she known to have any sort of medic? Get as much information as possible. But that didn't last for long because she started deteriorating again. So so this happened on 3 different occasions. So I again did a needle decompression again because I was just trying to delay as much as possible definitive treatment.
Yeah.
But after the third decompression, unfortunately, it didn't seem to work because she just kept deteriorating. And at which point I said, we just have to bite the bullet. So I spoke to her daughter who was with her, and I said, this is a situation, your mom is very ill. We've tried to stabilize her, but as you can see, she's not getting any better. If we do nothing, she'll definitely die. But I can try to do a procedure to try to save her. However, I can't guarantee you how successful it will be.
Your heart must have been racing yourself.
Well, yeah, because I'm thinking of doing this procedure. All I'm thinking is, what if this happens? What if this goes wrong? What if this happens? What am I supposed to do?
You're not in like an operating theatre or an emergency, because the thing you're talking about is, what are you going to do? You're going to...
Yeah, because now she needs to have a chest tube inserted.
Yeah, so a chest drain. He's going to have to put a chest drain into the lady's chest, which is like a large thing. Normally, it's a surgical procedure. It's we can do it in the emergency department, but in sterile conditions with, dedicated equipment to safely, and x-rays, to safely introduce this, large drain, not just a little needle, into the cavity. So you must have been looking in the first aid kit to see, she's about to die. I'm going to have to MacGyver up some sort of equipment here.
So at that point, I realized that, the airline had various boxes. So you have an airway box, and they have various equipment. But the most important one, which was the chest drain, obviously they don't have one. So at which point I had to think, how would I improvise to get a drain? Basically, I just want this lady's lung to be drained so that she can breathe properly. And it just occurred to me I could just use the oxygen tubing. So that very same, when we demonstrate oxygen mask coming down, so I just use the tubing for that. Make an incision, because there are blades on the flight, made an incision and be able to insert the tube into the lungs and then attach it to a bottle, which is what we'll normally use as an underwater seal. But I had to, improvise to to create that that proper seal because we need the air to come out but not go back into the lungs. And then that made her feel so much better until she was stabilized enough until we landed.
Hold on a sec. Okay, you've tubing, and then you used they had a bag of normal saline or something. You
So
found
it's a bottle.
a bottle.
Yeah, a
Okay.
bottle of normal
So
saline, yeah.
But how and you found a blade.
Yeah.
But all the medics on this sort of saying, yeah, but how did you get the chest drain in? You can't just get make a little cut and that's already a challenge, and push a floppy drain in. Normally there's a dedicated trocar, it's like a big bayonet, sterile that we use for a chest drain introduction. So how did you do that?
Yeah, so that was I would say was the scariest bit of the procedure because I looked around, initially I tried to insert it without the trocar.
Yeah.
I didn't expect it to go in because obviously you have the muscles and everything there which would impede that. And then I thought, how about I just use a hanger?
Coat hanger.
A coat hanger.
Like a metal coat hanger.
Yeah, so I just unravel it, put it straight, and then just use the tip basically to apply some pressure, and then to insert it into the chest. Obviously, not so that it doesn't go beyond the tube to not puncture and cause more issues.
Oh my goodness! And so you managed to roll the lady onto her side, and had she had some analgesia, or was she was unconscious at the point?
Well, at that point she was almost unconscious.
Yeah.
But we did have. I gave her some local. Yeah. Because there is lignocaine in the kit. Yeah. But also I gave her some. Once she got a bit better, she got better clinically. Then I gave her some oral some morphine as well.
And you've made an incision. You figured out which intercostal space, and you made it with like just basic lights, or somebody with an iPhone.
So basically, just use my landmarks, and then you just count, go down, go just above the rib, into the space, secure it there, attach it to the underwater seal, and at which point I said to the crew again, we need to
quicker,
land
faster.
Yes, please, because if this falls out, that's it. I'm not sure what else I can do.
And straight away you saw air bubbling through the underwater seal.
So this is how I knew it worked. So this is how I knew it worked, because you could see the oscillation as she breathed. You could see the water level moving. So at that point, I was a bit more relieved. But then now I had one other issue. I just kept looking just to make sure that there was no blood coming out of that tube, because I'm like, had I hit an intercostal vein, a vessel, anything? And I was just waiting, just watching, just to make sure. But it kept oscillating, which means that it was not blocked and there was no blood coming out. So I thought, probably we've been successful on this occasion.
And then he or she gets the plane on the ground not too much later.
Yeah, so we were able to land. Obviously, by that time they were already coordinating with the land crew, the on-ground crew.
Yeah. By the way, where did you land?
So we went to Puerto Rico.
Puerto Rico. Okay.
Yeah. So they had been coordinating with the team on the ground. The ambulance was waiting. So the paramedics, there was a medical team waiting. Handed over, gave my report. At that time, I'm sweating because the stress and because I'm just thinking, what if something happens to this lady? Because you also think of the legal implications. Even if
it's just
we know that
person's dying in front of you as well.
There we go. So that was what prompted me to really go to the extreme, because I just believe had I done nothing, she would have died.
Everybody would 100% agree. And did she survive the whole thing? Oh no. So before we get to that, so then the airplane refueled or something, did it? And you just went back down to your seat and put your headphones back on and stayed watching whatever documentary you're watching. And you went to the St. Lucia eventually, did you?
Yeah, so I became the hero on the flight. So
because everybody knew this was a big deal.
Yeah, everybody. I mean, probably persons did not know the extent of what was happening, but the fact that we had to divert the flight, everybody figured that there was something big happening. But then the flight attendants afterwards made an announcement, how we have a hero among us. We've said, at that point they upgraded me.
Oh, good.
The
front of the plane.
So they took me to the front of the plane.
Maybe a bit of whiskey or something to settle the nerves after me.
Yeah, so I got, changed my seat, they upgraded me on the flight, but then everybody literally, started clapping. The kids who were around were like, oh, I want to become a doctor, that kind of. So at that point I felt a little relieved, and, get that kind of satisfaction that you get. Yeah. But still a bit worried that, I'm not really sure what the outcome is going to be with that lady.
And then how did it go? Did you hear something eventually?
Yeah, so she went well. So subsequently, I received correspondence from the airline.
Yeah.
Basically, the family, they wanted to give me an update, and also because the family had basically they tried to get in contact with me to express their gratitude.
Yeah.
And interestingly, this week as well, because it's been a few years now, this week was the anniversary of the incident.
Yeah.
The family again tried to contact. I got an email from the airline because the family had contacted them saying that they wanted to say a special thank you because the mom was actually celebrated her birthday last a few months ago, and they just wanted to show their gratitude because of my gesture. That's the only reason why she's alive at the moment.
And this date, this time will mean a lot to them because it's the time that mom should have been dead on an airplane 40,000 feet up.
Exactly.
Look, it's an amazing story, and throughout life we do hear these great stories of individual heroism and all that. But in our talk here at Guy's today, following on from this, there were two additional things I wanted to speak to you about. One is you talked a little bit about the duty of responsibility and the challenges and indeed the uncertainties when there is a mid-air emergency and that call goes out. Is there a doctor or a nurse on board? And you gave us some insight into the sort of equipment they have. It's quite impressive. Clearly the airlines do put in some significant plans.
Absolutely.
We won't go through all in detail, but just a brief summary of I suppose the responsibilities or the reassurances you gave us this morning if that call goes out, and why we should be maybe obliged to help or certainly not afraid to be a good Samaritan.
Yeah, so in most countries, you don't have that sort of legal obligation. But what is expected of you as a medical professional is that sort of ethical, professional obligation to offer your services. At the same time, when you do so, you need to do something that's within your expertise. So no one would expect you to do maybe a tracheostomy if you've never done one before. You don't have the experience in doing it before. But what is recommended is that you do something that's within your expertise, and then you would be legally covered. And that what this basically means is, even if someone were to sue you, but you've acted in their best interest in an emergency, it's very unlikely for you to basically be penalized for it. Yeah. However, with the flip side, there are circumstances where this can happen, and if this is where you act in clear negligence, for example, if you've been under the influence and then you've decided to do some sort of procedure, you decided to assist someone, you within yourself should have known that you're not within that right frame of mind to do so and should have avoided doing it. And in these cases, there is that that window, that possibility of you being
acting kind of improperly, even if it's an emergency situation, I understand. And also you had some interesting tales about, for example, there's a big wide-body jet flying trans-oceanic, and the airlines sort of scale up the medical equipment they carry. I suppose that's because if it's small planes on 1-2 hour flights, they can probably all get down to the ground pretty quickly. But on the bigger planes, they do carry more equipment, like, for example, for the urology audience, catheterization kits. So you can definitely put a catheter in on one of these airplanes.
I was quite surprised. I was not even aware that they carried catheters on the plane, but in getting that sort of information from the airline, I realized they actually do carry different sized catheters on the plane. So my urologist colleagues here, if you ever get called and you have someone in retention, don't hesitate, don't be worried. You have catheters on board, and you could definitely help someone in retention.
And I suppose that is a proper medical emergency, as we know. And if you're on a 14-hour flight from Melbourne to Doha, and somebody's in your retention 3 hours out, you are going to have to land the airplane.
Absolutely.
So it makes sense, because you did say that you did some reading about this, and it's a very expensive thing for the airlines, especially for a big body jet like that, like $300,000-$400,000. If you're diverting a transoceanic jet, there's all sorts of stuff, so it's worth your while having a catheter kit on it. Now, finally, you had some lovely messages at the end for the academic group at Guy's Hospital here this morning, just how in being prepared for, as best we can in life, for that call on an airplane, there are messages that help us be prepared to be good clinicians in the workplace, and I would say just being good people. You had some nice messages to finish, Jimmy.
Yeah, so every situation we're in, it's always good that we look at the what sort of take-home message or lessons we can learn from it, and how we could apply it in our daily life or in future experiences that we may encounter. And a few of the messages. So one is to always be prepared. Preparation means, so for example, even persons, a lot of our surgeons here, how much time do you really take to know your patient, go through the investigations, know what you're really gonna do for that patient at the time of the operation? What about your basic training? Are you up to to date with your basic training? Are you reading? Do you know what's really happening? So, you know, be prepared. Always be willing to help. And, you know, we're not necessarily referring to on a flight emergency, but just in our general practice in our life, you know, be that person who someone can count on, because they know that if they call on you, you will be there to assist whenever you're able to, and not because you just brush them aside. The other point I brought across was, are you able to improvise when necessary? Because, you know, maybe we get very comfortable doing certain things in life. We operate, we do a procedure, maybe we've done it 1,000 times, but that one day where we find that unexpected thing, are we able to navigate our way through it so that we could give the patient the best possible outcome and not have to bail out unnecessarily? So, you know, so we always use these lessons so that we could improve our practice, but also improve, you know, our interactions with people in our daily life.
Well, if we were all so fortunate mid-flight having an emergency, I can't think of anyone better than Dr. Jimie here, and Urology Fellow at Guy's Hospital, to be helping us out. Thanks again, Jimie, and well done to you. So happy to hear this story and the really happy ending for the patient.
You are most welcome.
So we hope you enjoyed that. That's all we have time for on today's episode of GU Cast. We'll be back with more soon.